There's a very meaningful saying that I always get reminded of in the course of my profession. Invest in your face, it is going to represent you for a very long time. Well, yes, the face does all the magic. We are identified and most of the time loved for the face that we have. So why not have the best of it? Hi, I'm Dr. Priya Bansal, a board certified cosmetic plastic surgeon practicing in Delhi NCR with more than 12 years of experience. Today, I want to talk about a procedure which I have performed multiple times. Many people opt for it. Many people have had beautiful faces because of this procedure. It is called Buccal Fat Removal.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
So, before we start discussing the procedure, let us understand a little about the face and about the kinds of fat in your face. So, basically, we have 5 deep fat pockets in our mid face. The first one is the Retro-Orbicularis Oculi Fat, which is present behind the brow. The second is the Sub-Orbicularis Oculi Fat, also called the SU fat, which forms the tear trough region. The third and the fourth combined is the medial fat pads, which is present, the deep medial fat pads present medially and laterally. And the fifth one, the final one, is the buccal fat pad, which has multiple extensions of the face. So the buccal fat pad is present at the lowest point in the on the cheek at this area, and this is the bulge which the buccal fat pad provides. It shows in the cheeks, it makes them rounder, it makes them chubbier. So patients who do not want a rounder, fuller cheek, and in fact they're looking for a V profile or a V-shaped face, they opt for a buccal fat pad removal procedure. So let us now understand what exactly is buccal fat pad and how it is removed. So buccal fat, unlike the fat collection in other parts of the body, they do not grow or increase in size or decrease in size. Once you've achieved adolescence, the size of buccal fat pads, it remains the same throughout. And therefore, if you want to get rid of buccal fat, you need to get rid of them surgically. So how is buccal fat pad removal done? This procedure, it can be done easily under local anesthesia. Although some patients, if they are not very comfortable, it can be done under general anesthesia. After the administration of local anesthesia inside the cheek, a small incision is made around 4 to 5 millimeters, and through this incision, the buccal fat pad is teased out, dissected and extracted out. And this extra fat tissue is then removed, and the small suture which is there inside the mucosa, inside the cheek, it is sutured with an absorbable suture. Now, a very important thing to remember when we are removing the buccal fat pad is that we need to be a little conservative when we are removing this fat pad. If we remove all of it, it leaves a hollow cheek, a sunken cheek appearance, which makes your face look aged. So, with the removal of buccal fat pad, the cheek size automatically reduces and your face, it becomes proportionate. Your cheeks, they become proportionate to the rest of your face. Like I said, the procedure is performed from inside the oral cavity, and that is why it leaves no visible scarring on the outside of the face. The results look very natural and nice. This way, the entire procedure, it can be done in just 15 to 30 minutes. Now, let us discuss the recovery timeline for buccal fat pad removal. The downtime for buccal fat pad removal is negligible. There is some swelling on the face for around 4 to 5 days. There can be some stinging and burning sensation in the oral cavity from the suture, from the surgery, which subsides with time. And the suture, which is absorbable, it gets dissolved on its own over a period of few weeks. For the initial few hours, 24 to 48 hours, the patient is asked to eat semi-solid food. and cold liquids so that he has a little pain relief. And as the patient recovers over a period of 4 to 6 weeks, you can see the result on the patient's face with a slimmer, sleeker facial profile. And all of this is a very quick and a very safe procedure. As long as your surgeon has the required knowledge about how to perform the procedure, you are in good hands. They need access to the tools which make the surgery quick and painless. They should also know exactly where to make the incision, because if the incision is placed in a wrong position, they may injure the salivary duct. And this also helps in teasing out the buccal fat pad easily if you place the incision at the precise point. Now, since I have talked about buccal fat pad removal for sleeker cheeks, what if your cheeks already look deflated and sunken and you want them enhanced? Well, we have a procedure for that as well, which is fat grafting, or we can use fillers for the same. Now, fillers, they are substances which contain hyaluronic acid, which are inserted in the specific areas where you want more plumpier or more volume fullness. It adds volume to your face, and with the increased volume, your skin looks tightened. For the same purpose, instead of fillers, you can also use fat. Fat grafting is when we harvest fat from one part of the body and use this processed fat and graft it into another part. So this is also possible for the cheeks if you have a sunken cheek. Now, since this is your own tissue, your own fat, it does not get rejected and you get good results. Now, sometimes if you have a sagging skin, you may want to combine a buccal fat pad reduction along with a facelift. A facelift, it tightens your muscles and it removes the extra skin to give your overall face a younger and a slimmer look. So this way you can combine multiple cosmetic procedures to get a good result, to get a younger result. But again, it is all the goal of all of this is to give natural results. So today I've attempted to bring in as much knowledge as possible, not only about buccal fat pad removal, but a little bit about how your facial profile can be enhanced and improved naturally. If you want me to make a video on any particular procedure or topic, do let me know. I will definitely try to bring more educative content to you. Keep smiling. Have a good day. Take care. Bye-bye.